Hi everyone, this is Cameron Eldred. I'm currently a doctorate of athletic training student through Indiana State University, and today we're going to be talking about the injury prevention and disablement model. Now, a little bit about myself. I am currently a certified athletic trainer who is continuing my education, as I stated, through the Indiana State University Doctor of Athletic Training program. I recently graduated from the University of Utah with my Bachelor in Science, and I'm currently working through ISU with a middle school, high school in Indiana. So throughout the presentation, we're going to be talking about preventative concepts through the disablement model and the literature associated with injury risk and physical activity. So first, we need to understand what the disablement model is. Now, the Nagy disablement model was the original model, and it's recently been updated. However, it originally included four parts. The first was pathophysiology, which is the active pathology, cellular level. This is everything down to the very basic of what's going on with this person. Next was impairment, so body system, organ, things like that are being affected by whatever's causing the issue. Next is going to be the functional limitations. So we're looking at this person as a whole. We're trying to understand how this illness is affecting this person in their daily life. Next was disability. So how is this affecting them in their relationship to society? Is this, a societal thing that this person is going to be struggling with? Are they going to be looked at differently? And then, as I stated, the National Center for Medical Rehabilitation Research has updated it to include social limitations. So this includes what is the overall loss that's occurring and what barriers does this person have to overcome. So we're going to be looking at MTSS, or medial tibial stress syndrome, in a football running back. So as we look at the disablement model, we can see that the pathophysiology would be an overuse and microtrauma of the soleus muscle at its origin on the posteromedial tibia, or this is also inflammation, can lead to inflammation of the periosteum. Now, the impairment portion of this, body system, how this would affect them would be decreased weight bearing. Next, we're going to look at functional limitations. So it would be an inability to walk, to run, to go up and down stairs. This might affect the way that they drive. It might affect the way that they go up and down the stairs at their apartment. All sorts of different things have to be taken into consideration when we're looking at these functional limitations. Next, we would be looking at disability. So they're going to be this person will be unable to make quick runs as a starter for whatever football team that they're working with. So this is specific to this person. So, they're not going to be able to make the runs. They're not going to be able to hit the slots. They're not going to be able to do a lot of the things that a normal running back should be able to do. Now, looking at societal limitations, they're going to be looking at a loss of starting or scouting options for the next level of sport. So if they play at a collegiate level, they're going to be losing scouting options for the NFL. Same thing if they play at a high school level, they might be losing something scholarship-wise from a collegiate level. Now, what we need to look at for injury prevention is through TRIP. There's 6 stages. The first is going to be injury surveillance. Next is going to be establishing an etiology or a mechanism of injury for whatever's going on. We'll be looking at developing preventative measures, what the ideal conditions that we can apply those preventative measures in will be, so whether that's in a laboratory or in some type of a controlled environment. Then we need to understand the development of implementation, which will include ideas such as what kind of safety precautions are being taken in that sport right now to help prevent this, why or why not are we applying those, and do we need to start applying more of those concepts? And then next would be evaluating the effectiveness of this intervention in a practical way. So does this actually work in a practice or a game or an actual real life setting? So when we're looking at the TRIP injury prevention model, we're looking at injury surveillance, which would be increased foot pronation, repetitive stress, sudden increase in physical activity. Those are some of the things that we're looking at that kind of lead into this injury. Now, the etiology, or this mechanism of injury, can be stress on the periosteum, It could be distress of the Sharpie fibers, which connect the medial soleus to the fascia through the periosteum of the tibia, and then it inserts into the bone. Now, another possible consequence would be of repetitive stress imposed by impact forces that eccentrically fatigue the soleus, causing repeated tibial bending and bowing, which in turn can overload the remodeling capabilities of the tibia. So those are just a couple of different etiologies. Now, next we would want to develop preventative measures. So we would want to look at stretching this person, shock absorbing insoles, progression in their everyday practice and in their exercises. So next we would want to test those preventative measures in an ideal condition. So a lab test, controlled field-based studies, things like that that are going to give us optimum conditions in order to put these into play. Next, we want to understand the sport of football. What needs to be changed? Do we maybe need to change the warm-up? Are they doing just dynamic and not stretching? What kinds of safety precautions are already being taken that we could improve upon, or do we need to start implementing? And lastly, did the intervention work in practice? Did it work in real life? So the injury risk factors for such a person, you could be looking at modifiable risk factors such as lack of flexibility, muscular imbalance, necessary warm-up. Maybe they're not actually doing their warm-up, or the warm-up needs to change. Maybe they're fatigued, so they haven't, this kind of plays in progression. Maybe they didn't progress into the exercises that they needed to, which is causing them to fatigue. We end up with muscular tension. Non-modifiable types of things, we're looking at age, gender, of course, genetic makeup, previous injury, any type of familial history. Those are going to be all of our injury factors, our injury risk factors that we can't change. However, there's three types of prevention. Primary, which is we're just trying to take care of those healthy individuals. Secondary, we're looking at treatment, early detection, so we know that they have it now. And then tertiary, we're treating an actual condition because we know that they have it. We need to get them into surgery or injections. So at this point, we're trying to treat symptoms. We're trying to get that person healthy again because they have some type of a condition. So each of these increases as we try to take care of whatever type of injury we're looking at. In this case, it would have been MTSS. Now, all of this can affect the health-related quality of life of a person. So any type of proper identification of risk factors, this is going to help us in being able to look at a person and apply each stage of the disablement model and say, okay, how will this affect their life? And we can go from cellular level all the way to their societal level and how this is going to affect them in society. Now, injuries do decrease all health-related qualities of life. This is known, and we need to be working on these things. So overall, we can see that the health-related quality of life is affected by injuries, and the disablement model, along with the TRIP framework, we can work on injury risk and we can work on reducing injuries as a whole, as long as we use all of these as a whole. Thanks, guys.